Hey everybody, it's Matt. Welcome back. It is October 15th, 2025, and today we're going to do a little segment about blood thinners. Whether you're a veteran and have been dealing with PV for decades, or you're new and just discovering your own Polycythemia Vera journey, there's a lot of information that's being thrown at you in the beginning, and it's kind of overwhelming. So I thought I'd kind of break it down a little bit today for you guys. I don't dive deep. There's probably footnotes to some of the things I'll say today, but for not making a 20-minute video, I'll try to keep it as quick as I can. But hopefully this is helpful if you're just learning, or maybe you've been taking blood thinners for a while and you really never dove in. But I don't know. I'm just thinking I need to know what I'm taking, why it's doing what, because if I'm going to take a supplement or any other kind of medicine, I want to know how it's going to interact. So that's kind of my take on this. Hopefully it's helpful for you guys. I wrote a little script here. So here we go. Living with Polycythemia Vera means your blood's got a little too much ambition. It's thick, fast, and prone to mischief. But you've got allies. Today we're comparing the most common blood thinning treatments that help restore balance. Think of them as peacekeepers in your bloodstream, and each one has its own strategy. So I created this little chart here. It's the treatment. We're going to do phlebotomy first. It's a mechanical treatment. It works by removing excess blood to reduce the thickness. It's the first line for most PV. It's immediate. It's cost effective. The downside is there's a lot of frequent visits potentially, and also iron loss. I was fortunate never to have to go to the phlebotomy route, but unfortunately because I was in the high risk category and kind of went right on to Xarelto and Bezremi. We'll get to that in a sec. The second line is aspirin. A lot of people do phlebotomy and aspirin. Initially, again, I did not go that route, but aspirin is an antiplatelet, prevents platelets from clumping. It's widely used in low-risk PV, easy to take. It reduces clot risk, bleeding risk. It reduces clot risk, but there is some bleeding risk and can cause stomach irritation. Xarelto, the anticoagulant factor XA, blocks clotting factor XA, sometimes used in high-risk PV or someone with a clot history. No routine blood tests are needed. It is higher in cost. My insurance does cover it, so grateful for that, but that is something to consider. There are bleeding risk, and can be a little tough on your kidneys as well. So that's where that water comes in. Lots of water, kind of staying hydrated. Then there's Eliquis. That's another anticoagulant, factor XA, similar to Xarelto. It blocks clotting. Alternative to Xarelto. There's a lower bleeding risk than warfarin. It is a bit higher in cost and can take a toll on your kidneys. Then there's heparin. It's an injectable anticoagulant. When I did go into the hospital initially with the portal vein, I was on a drip, heparin drip, for about 5 days, and it inhibits thrombin and factor XA. It's used short-term in hospitals or surgeries. It's very fast-acting. It has a reversible injection or a function, and again, that's a footnote. I guess we won't get into that, but I think that can be reversed a little easier than if you're taking Xarelto every day for years. It does need to be monitored. And then we get into the hydroxia, which is the it's not so much the blood thinner. This is more of the treatment that will slow red cell production in your marrow. It's for high risk or older PV. Reduces clot risk, spleen size. There is a risk of cancer, but it's rare, and it causes fatigue. And then you get into the interferons like the Bezremi, which are immune modulator, targets marrow cell production. It's used in younger or pregnant PV patients, high risk patients. It's disease modifying. It has disease modifying potential. Some of the side effects are the cost, or the downsides, I guess, the cost, and can create lots of different side effects, flu-like symptoms, the itching, other fatigue symptoms. So anyway, to break that down, PV isn't a one-size-fits-all. Your age, your clot history, blood counts, they all shape your treatment. Phlebotomy is the go-to for quick relief. Aspirin is the daily shield, simple, effective, and widely used. Anticoagulants like Xarelto and Eliquis may be added if clot risk is high or aspirin isn't enough. Heparin steps in during emergencies or procedures, and then hydroxyia and interferon, they go deeper, controlling the source of overproduction directly. As always, talk with your hematologist, your MPN specialist about your risk level, monitor your hematocrit, platelet counts, your symptoms like burning and itching. Consider your lifestyle. Are you active, traveling, managing other conditions? Keep a med list and ask about interactions, especially with supplements or NSAIDs like aspirin. So anyway, hopefully that's helpful. Sorry about all the reading and a little stumble here, there, and there, but hopefully that kind of answers a few questions for you. So in closing, PV, your blood may be bold, but you're wiser. Choosing the right treatment isn't about just thinning it, it's about restoring harmony. Like a kingdom with too many warriors, peace comes when the right leaders step in. And a little spiritual thing here, I just wanted to leave you, hopefully this is uplifting, something to consider. It's from Proverbs chapter 4, verse 23. Above all else, guard your heart, for everything you do flows from it. So let's guard it well with knowledge, courage, and grace. So, as always, please know I'm praying for you, and advocate for yourself, lift yourself up however you need to, and God bless.